After turning 60, your feet might actually be warning you about your heart. Most people think of shortness of breath, chest pressure, or fatigue when they imagine heart disease. But here's something surprising. Your feet are often the first part of the body to show signs of circulation problems, sometimes weeks, months, or even years before heart symptoms appear. Today, we're breaking down 4-foot symptoms that can reveal hidden issues with circulation, blood vessels, and your heart. Foot swelling, cold feet, changes in foot color, loss of hair on feet or toes, and most importantly, we'll explain what each sign really means, why it happens, and when you should get it checked. Sign number 1, foot swelling, edema. Foot swelling, known medically as edema, is one of the most visible and easily recognizable indicators of circulatory and cardiovascular issues in older adults. While swelling can occur for several reasons, persistent or worsening swelling in the feet, ankles, or lower legs after age 60 often suggests that the heart and blood vessels are not functioning as efficiently as they should. Understanding the mechanisms behind swelling, its appearance, and its relationship to cardiovascular health is crucial for early recognition of potential problems. What foot swelling is? Foot swelling represents the accumulation of excess fluid in the tissues of the lower extremities. Normally, the circulatory and lymphatic systems continuously move fluids throughout the body. When these systems cannot keep up with the demands placed on them, fluid begins to leak out of blood vessels and collect in the surrounding tissue. This buildup can occur in the skin, fat layer, connective tissues, muscles, space around the joints. The presence of swelling signals that the body's fluid-regulating systems are under strain. This strain often reflects deeper issues within the cardiovascular system. Why foot swelling happens more in older adults. Aging naturally affects blood vessels, the heart's pumping ability, and the kidney's ability to regulate fluid. With age, several processes increase the likelihood of swelling. Reduced vein elasticity. Veins become less flexible and their valves weaken, making it harder to push blood upward toward the heart. Slower lymphatic drainage. The lymphatic system becomes less efficient at collecting and returning excess fluid to the bloodstream. Decreased muscle activity. Calf muscles, crucial for pushing blood upward, tend to weaken with age. Gravity fluid pools downward throughout the day, especially when circulation is not functioning optimally. For these reasons, the feet and ankles are the most common areas where swelling first becomes noticeable. 3 major medical causes of foot swelling in seniors. There are several potential causes, but a most important, and the ones most directly linked to heart and circulation health, are the following. 1. Heart-related causes. Foot swelling is often associated with forms of heart failure, especially right-sided heart failure. The right side of the heart is responsible for receiving blood from the body and pumping it to the lungs. When it weakens, blood backs up into the veins, increasing pressure and causing fluid to leak into the tissues of the feet and legs. Congestive heart failure, CHF. CHF occurs when the heart cannot pump blood effectively overall. The kidneys receive less blood, signaling the body to retain fluid. The result is swelling in the legs, rapid weight gain, and shortness of breath. In both cases, swelling is a visible reflection of reduced pumping power. 2. Venous insufficiency veins contain one-way valves that prevent blood from flowing backward. When these valves weaken or fail, blood pools in the lower legs, creating pressure that pushes fluid out of the vessels. This leads to chronic swelling, skin discoloration, visible veins, heaviness or tightness in the legs. Venous insufficiency becomes more common with age and is a significant cause of daily recurring swelling. 3. Kidney-related causes. The kidneys regulate fluid, sodium, and waste. When they do not function properly, the body retains fluid. Kidney-related swelling often starts in the feet because gravity pulls fluid downward. Chronic kidney disease is common in older adults, and swelling may be one of its earliest signs. 4. Medications. Many medications used by older adults can contribute to swelling. These include blood pressure medications, especially calcium channel blockers, steroids, hormone therapies, certain diabetes medications, NSAIDs like ibuprofen or naproxen. These drugs may cause the body to retain sodium or water or alter blood vessel function. 5. Lymphatic system issues, lymphedema. If the lymphatic system is damaged or functioning poorly, it cannot drain excess tissue fluid efficiently. This leads to thicker, firmer swelling, usually in one leg but sometimes in both. Psoariasis. Prolonged sitting or standing. Extended periods without movement reduce the calf muscles' pumping action, increasing the likelihood of swelling. This is more noticeable in people over 60 due to reduced muscle strength and slower circulation. Management and treatment options. Treatment depends on the underlying cause. However, several evidence-based approaches help reduce swelling. 1. Lifestyle approaches. Leg elevation. Raising the legs above heart level reduces venous pressure and encourages fluid return. Reduced sodium intake. Lowering salt intake helps the body release excess fluid. Regular movement. Walking activates calf muscles, supporting venous return. Hydration. Adequate water intake helps kidneys flush out sodium. 2. Compression therapy. Compression socks or stockings improve blood flow, reduce fluid leakage, decrease daily swelling. They are especially beneficial for venous insufficiency. 3. Medical management diuretics, used for heart failure or kidney-related swelling to remove excess fluid. Heart medications improve pumping strength and reduce pressure in the veins. Vein treatments. For chronic venous insufficiency, procedures such as laser therapy or injections may improve circulation. Lymphedema therapy includes specialized massage, compression, and skincare. Sign number 2, cold feet. Having cold feet may just mean you're in a cold room, but if your feet are always cold, especially when the rest of your body feels normal, this can be a sign of reduced blood flow caused by blocked or narrowed arteries. After age 60, one of the most common circulation disorders is peripheral artery disease, or PAD. Why cold feet can signal heart problems? PAD happens when fatty deposits, known as plaque, build up in the arteries of your legs. This restricts blood flow and makes the feet feel colder than the rest of the body. The concerning part? PAD in the legs is often a sign of atherosclerosis elsewhere, including the arteries that supply the heart. In fact, people with PAD are much more likely to develop heart attacks, strokes, or coronary artery disease. How to tell if it's circulation-related coldness? Ask yourself, are your feet cold even when your socks are thick? Do others say your feet feel unusually cold to the touch? Are only your feet cold while your hands feel normal? Does walking cause leg or calf pain? Do your feet warm up slowly after a bath or shower? If so, the issue may not be temperature, it may be blood flow. When to be concerned? If cold feet come with numbness, tingling, cramping when walking, pale or blue toe color, These are classic PAD symptoms. PAD is often missed because it develops gradually. Many people assume cold feet are simply poor circulation and ignore them. But persistent cold feet after age 60 are worth a conversation with a health professional. Sign number 3, color changes in the feet. Your feet should be a fairly consistent color, usually pink or slightly red. But if you notice blue, purple, red, or very pale feet, this can be one of the clearest signs of circulation or heart problems. Let's break down the 3 most common types of color changes. 1. Blue or purple feet. This usually means that the blood reaching the feet isn't carrying enough oxygen. Causes can include peripheral artery disease, heart weakness, blood vessel spasms, blocked arteries. If your toes or feet look bluish, especially when you elevate them, your arteries may be too narrow to deliver oxygenated blood. 2. Very pale or white feet. This indicates reduced blood flow or temporary loss of circulation. It may happen when you cross your legs, you elevate your feet, you're in cold weather. But if your feet stay pale for long periods, or if they are painful when you walk, that's a classic sign of arterial narrowing. 3. Red, hot, or darkened feet. This can occur when blood pools in the feet due to weak veins or heart failure. You may see dark, shiny skin, redness after standing, skin that looks tight or stretched, visible veins. If the color changes drastically depending on whether your feet are up or down, pale when lifted, reddish or bluish when lowered, that's a sign of circulation trouble. When foot color changes are serious, seek medical attention if you notice. Bluish or purple toes that don't warm up, sudden color changes in one foot only, pain and color change together, sores or wounds that stay open. Color changes are an important clue. Your blood isn't moving the way it should, and catching this early can help prevent more serious heart or vascular problems. Sign number 4, foot or toe hair loss. This one surprises a lot of people, but it's completely true. Hair loss on your toes or feet can be a sign of poor circulation. As we get older, it's normal to lose some hair on the legs, but if the hair on the front of your ankles, tops of your feet, or your toes has suddenly disappeared, this can signal that the tiny blood vessels in your feet are not delivering enough nutrients. Why this happens? Hair follicles need a steady supply of oxygen-rich blood. When circulation weakens because of arterial narrowing, the body prioritizes major organs and reduces blood to the skin and hair. So the hair stops growing, and because PAD and atherosclerosis commonly cause this reduced flow, toe or foot hair loss can be an early sign of cardiovascular disease. How to recognize circulation-related hair loss. Look for smooth, shiny skin on the feet or toes, noticeable decrease in hair compared to the legs, brittle or slow-growing toenails, cooler skin temperature in the same areas. Why it matters? This is one of the earliest indicators of poor blood flow, long before pain, color changes, or open sores develop. Many doctors consider loss of hair on the feet a valuable symptom when diagnosing circulation issues in older adults. When to see a doctor? Here's the bottom line. Your feet are often your first line of defense when it comes to heart and circulation problems, especially after 60. You should talk to a healthcare provider if you notice persistent swelling, consistently cold feet, color changes, loss of hair on feet or toes, pain or cramping in the legs when walking, slow healing wounds or sores, numbness or tingling. These signs don't always mean heart disease, but they do mean something in your circulation isn't working the way it should. Catching these signs early can help you prevent more serious issues like heart failure, stroke, or severe PAD. Your feet might not be the first place you look for heart problems, but they're often the first place your body tries to warn you. Pay attention to the signs. Take care of your circulation. And remember, your feet might be telling you more than you think. If you found this helpful, make sure to like the video, subscribe for more health insights, and share it with someone who might need this information. Stay healthy, stay proactive, and take care of your heart, starting from the ground up.